This is COVID-19 Front Radio. I am Lawrence Tabani, and we're coming to you from Community Constituency COVID-19 NAF Center here in Pretoria. And today we are honored to have the Deputy Minister of Women, Youth, and Persons Living with Disability, Professor Hlengiwe Mkhize, in the studio with us. Prof, thank you for being with us in the studio, and thanks for paying us a visit.
Well, thank you very much for having me.
Yeah.
I must say, when I entered the building, I was overwhelmed.
Oh, yes.
I've been in many community radio stations, so I expected, that small passage and, behind.
Kind of,
yeah, so it's really,
Yes.
it shows what you are capable of doing.
Yes,
Yeah.
even during disaster, that
Yeah.
it's not only bleak future that we're seeing, but this disaster can bring out the best out of us and offer some opportunities. There you were being interviewed in our little mini studio of television, and now mini radio station here.
Amazing innovation, I must say,
How
and
do you see,
creativity.
Prof. How do you see this NAF Center working with your department and addressing some of the issues pertaining to the women, youth, and persons with disability? I mean, some people will say that you are heading the sector that is the most vulnerable in our society.
Yes, but also the president himself has taken over these sectors,
Yes.
women, youth, and persons with disability.
Yes.
And he provides leadership on strategic issues that are a priority for them. So it's important to see you as a civil society link and make sure that whenever we have to implement programs, we communicate through your center,
Yes.
so as to reach out to the people that we want to make sure that they get the information.
Yes, and respond to this threat, this disaster that we are facing. It has really engulfed the whole world and taken it by storm. Has there been an impact, a different impact altogether on this sector since the lockdown and since this COVID embraced our country?
First and foremost, we all said we're dealing with a pandemic. So our constituency have to get accurate information. Remember, there's a lot of fake stories and news around COVID-19. So as an educational program, using the virtual, the Zooms, the Microsoft Teams, and so on, we've been communicating with the leaders within our sectors. Up next is the one on persons with disability with them. Just to make sure that there's a clear understanding why we're in a lockdown, and to appreciate in turn the inconveniences they are facing because of what we did. For instance, many people didn't even know how this affected autistic
Children and people.
children and young people and older people who survive by taking a walk or going for occupational therapy or playing games with a trained person. So we've had to look at that and to communicate it to the Command Commission. But also, the most important thing really was to interfere and make sure that there are specific directions as to how persons with disability should be assisted during this period of the pandemic, where we talk about social distancing. And some of them, they rely on a guide.
Yes.
So what kind of social distancing will be ideal for them? What do you do to train the guide and to make sure that they access the personal protection equipments?
Yes.
Because that also was another challenge. The sector was left out completely, not benefiting, not able to fight for these equipments out there in the community where, it's the survival of the fittest.
Yes.
And so, again, another issue, we realized our people live in abject poverty. When they were supposed to be locked inside, then you saw numbers running outside looking for anything, even soup. Some standing for soup, wanting soup and food parcels and any form of food that they could get so as to feed their communities. And so we triggered off our UN partners, agencies, to say, how can you help?
Yes.
And a lot of money has been put in place whereby we started calling the leaders of the blind, the leaders of the deaf, and say, take this, use your machinery, and make sure that persons with disability, they access this,
Yes.
so that they don't only rely on what government they can do.
Yeah.
During the issuing of the SASSA social grants,
Okay.
we said, look, they can't come on the same day with all other people.
Stagger it out.
Yes, make sure they come with the elderly. So it's, you know, it's new for all of us.
Moving target.
Yeah, but you have to be vigilant. You know what? This virus has taught us something.
Yes.
That even as government, you don't have to be bureaucratic and conservative. You have to respond quickly and strategically. Otherwise, you can cause harm, great harm to our societies. I mean, you have seen, then we realized other people were saying, how do I wash hands
When we don't have water?
obsessively if we don't have water? And, you know, government doesn't need any praise, because what we have done, we're supposed to have done since 1994. And so there are many interventions. The question of small businesses. You know, we've always had spaza shops. We've always had women who brought up children, who educated them, who were selling fat cakes, amagwinya.
Amagwinya, yes.
Everybody will know, Auntie Amagwinya. Auntie, where are you? We want Amagwinya. But now we've had to bring that to a bigger table to say they can't be in a lockdown.
Yes.
They have to be assisted. And they are amongst those who are going to benefit from the
grant from
grants.
the without them having to operate.
Yes.
They will have to be paid from what the president announced. That's a,
but also
that's a pass.
we started opening some of their operations, especially those who are registered and so on, and others have been registered, and small business will be supporting many of them during the lockdown.
Okay.
The third level, they're busy processing them and so on. Even our NYDA, because the president during the State of the Nation address have called for these 1,000 businesses that must be supported. They are processing, working on it, supporting the Department of Small Business, so as to make sure that when we get to level 3, at least they become operational.
yes.
I mean, the kind of resources that have been mobilized, they have nothing to do with the budgets of those departments. But the crisis have led us to that reality that we don't know post-COVID-19 what kind of economies we'll be talking about.
Exactly what I was going to touch on when you talk about the budget that was announced from the Ministry of Treasury, that now with this COVID-19, it must have impact in your budget and just how you're going to be juggling that, some of the programs that you were going to embark on. Now with this immediate disaster, how are you juggling the budget around?
Well, you know, the president wants, from day one, when he took over, he wanted us as government departments to work in a coordinated, integrated manner. You remember that when we had these horror cases of gender-based violence,
Yes.
he then said to cabinet, all of you, look at your approved budget, and I want you to locate money which you had earmarked for gender-based violence. I don't expect less than 1.2 billion. He courts, to Tuzela centers, strengthening them, and so on and so on. So, post-COVID-19, we expect the same command to identify priority issues and for the commander-in-chief to say to all the departments, work together on these as priorities. And I think the economic revival, remember we were struggling in terms of high rates of unemployment,
Yes.
and our GDP was not doing well.
That's so true.
And so post-COVID-19, how do we work together to focus an economic revival in such a way that it's an inclusive agenda, especially of people at a lower level? Because the BE really has not helped us.
So
It
true.
created a few millionaires, and so there's no impact at a larger community. But strengthening the Department of Small Business and giving immediately to them about 500 billion to say, you have to play around, you have to see what you can do. It meant, let's build economic structures from the bottom, the middle level, right up to the top, those who need to be rescued and so on, but also to open the markets, because some of our people, like those who in beading and the traditional clothes which are so popular amongst women, they don't grow because they don't have access to markets. Their goods, they will be taken by you and me, and we end up putting it in boutiques and again creating 1 or 2 millionaires instead of building an economy of the country on a massive scale.
One of the worrying factor that's been coming up since this lockdown is the gender-based violence stats that we are hearing coming from Mr. Mkhize, the Minister of Police, that the calls are just out of hand now, and the number of cases that are being reported that's been happening during this lockdown. What do we know about this pattern? Is it something new, and the reasons behind why this gender violence should go out of hand?
Well, you remember the cases we had last year of a student from the University of Cape Town,
Yes.
Winene,
There was
and
Limpopo one as well.
yes, when we were in Limpopo in August, there was one student who was stabbed 21 times, living in a house with a family, and then the intruder came in and then stabbed her 21 times, and many others. And so we were aware that there's a kind of anger. We always say patriarchy is a problem. But once you see these brutal cases, you realize that it's more than believing I'm a man, I'm in a powerful position than a woman, because that's a patriarchal mindset. Is this quality, the brutality, where
Diabolic.
where instead of raping a child, Tasne van Wyk in the Western Cape, 8-year-old, why do you then have to take her and dump her somewhere instead of leaving her in a place where parents could be able to see a child? And of course, we know people are trying to make sure that there could be no forensic work done if the body is in the state where it is just not easy to even identify who this person is. So we knew there was a kind of cruelty, but the number of cases that now are overwhelming our gender-based violence hotline, they really tell us that at least people moving up and about, going to work, being away from each other has been a saving grace. Now that they have to share space, they have to negotiate a meal, what do we eat, what to do, who is going to do this, has created a crisis. It means we have the kind of families which have been held together by the absence of the another because of work. And so now that they don't have an option, it's a war zone. And imagine there are children in the setting.
I know.
Yeah, and also the trauma, we know that it tends to have impact. It can be generational, because a young boy who saw the father abusing the mother or the...
Since he thinks it's normal.
Yeah,
That's the way things are.
he goes up, he grows up with that kind, internalizing those values and act them out somewhere. And so those are some of the
issues
that have been brought to the fore. Remember, we're dealing with this instead of ensuring that we are saying to our people, wash your hands, observe all the hygiene principles, social distancing, stay home, the virus doesn't move, you move around, you bring it back to your family.
Infect the entire family, yeah. But how do you deal with that now, given these conditions of lockdown? Are these women being taken to, who are being abused in the households, to a place of safety? What immediate measures are there to assist them? And these perpetrators, are they being arrested in the meantime, when we know our prisons are overpopulated, and human rights lawyers are now even talking about having to release some of these prisons, and we heard about paroles of these prison doors being open for some in avoiding this COVID-19. How do you deal with this immediately, because this is a problem at the moment? Are these women safe somehow?
Yeah, they are not. We are all supposed to prioritize the pandemic. But now we are aware that it's causing other problems. Women are up in arms against parole, saying you can't give these men parole because we have seen what has happened in the past. They are given parole, they go and they cause harm at a community level. So it's being caught, between a rock and a hard stone, where you don't know which way to go. But we have encouraged women to continue reporting cases. With regard to the shelters, now many, they've been allocated for gender-based violence cases, so that women can move away and allow the police and investigators to deal with cases.
Yes. I'm told our time is up. Minister, I thank you so much for being with us, and we hope we'll see you again in the next not so long distant future.
Yeah, thank you so much. I really appreciate this.
Yes.
Thank you.
Professor Hlengiwe Mkhize is the Deputy Minister in the Department of Women, Youth and Persons Living with Disability. I am Lawrence Tlhabane, and my producer Kenny Mudise, content creator is Fofole Refolo, and technical engineer Steve Kosi Ramohama. Remain vigilant and adopt good personal hygiene practices.